This is the Home Healthcare Today show. I'm your host, Dr. Cleamon Moorer. The Home Healthcare Today show is brought to you by Meridian Health Plan in Michigan. Today's topic is very important. This is Maternal Health Awareness Month, and our topic is protecting our mothers, confronting the maternal health crises. The United States has the highest maternal mortality rate of any high income nation in the world. And more than 80% of those deaths are preventable. Today, we talk about what we can do differently. We have the honor to have two distinguished guests from Meridian Health Plan in Michigan who live this work on a daily basis. Shanita McClary is a manager of health equity and quality improvement. Shanita is an experienced quality improvement leader. She has spearheaded Meridian's outreach to doulas and built partnerships with organizations including MAY, the Southeast Michigan Perinatal Quality Improvement Coalition, and the Black Mothers Breastfeeding Association. Shanita leads Meridian's Maternal Infant Health Work Group, which addresses challenges such as low birth weight and health disparities that disproportionately affect Black mothers and babies locally and nationally. Also today we have Sarah Riley, nurse, RN, Sarah Riley. Sarah works within the Population Health and Clinical Operations Care Management team. She's a clinical specialist. She supports those providing member care management and implement interventions based on data trends, initiates programs to improve member outcomes. Shanita and Sarah, welcome to the Home Healthcare Today show.
Thank you.
All right, now your roles are different. So as we think about different roles, Shanita, you lead health equity initiatives, and Sarah, you work with the clinical care management side. How do your roles connect when it comes to supporting mothers?
We have a lot of overlap.
Okay.
There, we tend to take a holistic approach to treating our members,
Yes.
and this includes everything from medical care, so that could be clinical side, but also taking into account the health equity piece,
Yes.
mental health care, so their emotional care, all part of the whole person, and can't forget the social economic needs as well.
Sure.
We work to eliminate any barriers for the member getting their medical care or their mental health care by addressing those socioeconomic pieces. So,
Yes.
what can we do to help our members?
Yeah.
And although sometimes the member will only have one appointed person
Yes.
when they to speak to when they call into the health plan, there are a lot of departments working behind the scenes to make sure that all of these aspects are taken care of. So in these dedicated spaces, Shanita and I work very closely to go through that. So
Yes, Sarah and I do. We collaborate very closely. We actually have created a collaborative space where not only the two of us, but other departments, as Sarah indicated, we work together to come up. We basically investigate the root causes and we work together to come up with evidence-based solutions that address those disparities and disproportionate, health outcomes. Sarah leverages her clinical expertise and I leverage my data-driven and disparity reduction work to come up with those solutions, evidence-based, culturally appropriate interventions that are designed to enhance the outcomes and reduce those disparities for our moms.
Wonderful, wonderful. Now that's a perfect segue as we talk about disparities and we talk about health, equity and some of the challenges there. Now, Black mothers are 3 times as likely to die from a pregnancy-related illness, right, than white moms. For those that find that statistic troubling, what's behind it? What drives that?
Well, let's know, as you had stated previously, 80% of those cases, that's 4 out of 5 cases, are preventable. That's deaths that are preventable. Most of those deaths are an effect of either hemorrhaging, they are an effect of mental health conditions and cardiac conditions that go unaddressed or treatment is delayed. We also understand that there are systemic failures that impact those deaths, such as limitations on lack of accountability for those that are performing poor practices.
Yes.
There are also lack of access to high quality, standardized care, making sure that everyone gets the same treatment wherever they go. There are also social determinants of health that goes unaddressed. Many times Black mothers are dismissed. Their concerns, their issues are dismissed or either ignored. And then that means that treatments are delayed. That means diagnoses are delayed. So that is what's leading to that crisis, unfortunately.
Meridian's making a difference, though. Meridian's doing a lot to address the crisis, right? So the doulas, the doula difference, right? And Shanita, you formed these partnerships with May Health and other organizations. For viewers that are unfamiliar with doulas, what role do they play, and why is Meridian investing in?
Meridian loves doulas.
Okay, all right, that's a hashtag. Okay.
Meridian loves doulas.
Yep. Okay.
Doulas are non-clinical care.
Yes.
They are part of the CLARE team, but they are non-clinical.
Uh-huh.
Doulas play a very critical role in
Yes.
birthing experiences for birthing individuals.
Yep.
They provide physical support, they provide emotional support, and they provide education to birthing individuals and their families.
Yes.
Doulas are, they do not replace the medical care team.
Right.
They actually complement the team
Yes.
by being an advocate for those individuals
Love it.
when they're in times of distress or they're in their most vulnerable, experiences.
Yes.
Those that have a doula, it's been proven, the data shows there are less C-sections, labor is shorter, there are less stays inpatient in the hospital,
Sure.
less preterm deliveries. Those that have a doula, they tend to attend their prenatal care appointments.
Yeah.
They attend their postpartum care appointments. Those that have a doula, those infants complete their well visits.
Yeah.
Those that have a doula are, those infants are actually born at normal and healthy weights.
Okay.
And most importantly, birthers that have a doula as a part of their birth team, they tend to be more happier and have increased satisfaction. So, all of those checkpoints, they align closely with our priorities.
Happy to hear
why
it.
not support the doulas
That's
and the work that they're doing?
There you go. It sounds like the doulas are like a modern day midwife, right? Just,
That's exactly. It's been,
Yep.
it's a historical proven solution.
Absolutely. Right.
Yeah, it goes back historically to those times when a lot of African Americans could not go to hospitals and they were turned away.
Absolutely.
So yeah, so it was a part of that. So we're thankful that it is now a Medicaid benefit.
Yes, it is.
And we're able to support, and doulas are able to openly be a part. Everyone has access to a doula.
Awesome.
Yeah, so we're definitely, so we are investing because we do believe in that, because it does align with our priorities. And we have partnered with May Health.
Yes.
May, basically they're a digital solution.
Great.
They support the doulas, they support the members. So May, basically, now that it is a Medicaid benefit, May takes the administrative burdens off of our doulas. They basically handle the credentialing, the contracting, the billing, the claims processing, and the payment processing on behalf of doulas, so that doulas can focus on their birth work.
Wonderful.
And do what they love to do.
Love it.
For our members that have access to May has basically a culturally appropriate or relevant model of perinatal care that they basically offer for our members. So they provide that education so that members understand what a doula does and the benefits of having a doula, but they also work to ensure that everyone that wants a doula has a doula.
Okay.
So May also offers, so they connect our members to doulas that match their preferences, their cultural preferences, or their personal characteristics, any preferences that they may have. May also is an extension of Meridian. There are eyes and ears. They are touching and coordinating and working with our members on a weekly basis, routinely assessing for any social needs that our members may have, assessing for any physical or health needs that they have, and they notify us, alert us in a timely fashion
Okay.
so that we can respond and address those barriers. So we are very proud of the work that we're doing with May.
Yep.
And also Meridian also offers unlimited doula benefits.
Okay.
So any member that during their perinatal experience, prenatal and postpartum, they have unlimited visits. So they don't have to worry about any limitations of not being able to have access to a doula of their choice. Meridian also, we are just so invested in the doula implementation that we have, we offer scholarships to help any birth worker that is interested in joining the Medicaid doula network become a doula, a trained certified doula with the state. So, yeah, so it's just our goal. It just aligns, the May model aligns with our model, you know, of just making sure that we eliminate these disparities and, you know, do our part, you know, ensuring that everyone has full and open access to, you know, an optimal health experience and birthing experience. Yes.
Exciting and encouraging. Yes. Thank you. Thank you, Shanita. Sarah, as you think about that, you know, that the clinical side as well and high risk. So some moms are high risk, whether it's due to some of those social determinants of health not being mitigated, whether it's due to heredity or a health practice per se, or even an aging mom, right? Walk us through it prior to our commercial here. Whenever a high-risk mom reaches out, or a doula in some cases is working with a high-risk mom, how does the care management team swing into action?
So I'll start with defining what a high-risk mom is to Meridian.
Yes.
There's a couple different ways they're identified.
Okay.
First, we have the notification of pregnancy assessment that is completed. I won't go into too many details on that because it's an assessment, but it has to be filled out for us to know that you're pregnant.
Okay.
From there, a member of our care team will reach out and complete a trimester assessment, depending on which trimester that the member is in. And from there, that trimester assessment goes over a lot of different factors like birth history, like kind of the things that you mentioned, you know, the age, the race, what socioeconomic factors you might have. And based on all of those things, it provides a risk score. The care management team of nurses do take care of the high-risk members. So you would be members would be assigned to a nurse. And we help put together care plans based on what the member would like to work on, and with a little bit of clinical advice thrown in as well. You know, attending prenatal appointments, attending postpartum appointments are very high on our priority list. Members who do attend prenatal appointments do have lower instances of maternal morbidity and mortality, and higher birth weight babies, reduced C-section rates, and things like that. So we help to educate and help the members have that education to advocate for themselves, and just make sure that they are aware of our benefits. There's a lot of things that maybe the member doesn't know about without working with us. So
absolutely, that is a lot of
get to the benefits. But
no, that's a lot of helpful and rich information. You're gonna have time, Sarah. We're gonna go to a commercial. No worries at all. We're gonna go to a commercial, and we're gonna talk more about what moms don't know and how we could get them better informed. We'll be right back. We went from podcast to broadcast. The Home Health Care Today show is back. I'm your host, Dr. Cleamon Moorer. The show is sponsored by Meridian Health Plan in Michigan. Stay tuned. Welcome back to the Home Health Care Today show. We are having a very informative conversation about maternal health and Maternal Health Awareness Month. Yes, so picking up where we left off from our commercial break, a Meridian Moment. Meridian Moment focused on rest, healthy sleep habits, yes, as tied to maternal health and overall health and wellness. 7 to 9 hours is what is suggested for the average adult. And then, of course, for a new mom or mom-to-be, rest and sleep is very important. And we don't want to sleep on the benefits that Meridian offers to moms. So picking back up where we left off, what are some of those benefits, team, that Meridian offers that a lot of moms just don't know about?
It's so important because as a new mom, you're not sleeping very much.
Not much.
So let's not forget what these are.
Yep. Yep.
But
That's
things
right.
that for sure can help with that
Yeah.
are unlimited doula benefits, like
Uh-huh.
Shanita had mentioned.
Yep.
We have dental visits, maternal infant health partnership visits. That's a visiting nurse that can come out to your home.
Yep.
Smoking cessation
Mm-hmm.
programs that we offer.
Very good.
We do offer group prenatal care and resources with helping you get in touch with a group that will be personal for you. Transportation, we do offer rides through our partner to any appointments or even to the pharmacy to get your medications.
Yep.
On that note, we also cover prenatal vitamins.
Okay.
And with transportation, if you do have your own vehicle, we also provide gas mileage reimbursement through that partner too.
That's good.
We offer durable medical equipment, so things like blood pressure cuffs, breast pumps, glucometers if you're diabetic. So important to have those things in order to be on top of your own healthcare and to advocate for yourself.
Certainly.
In terms of like socioeconomic needs, we are able to help, and please call into Meridian if you have any needs. But anyone at Meridian can get you in touch with any resources for housing, food insecurity, employment and education, utility needs like heat, especially in this weather, shelters, mental health, and domestic violence is very prevalent, unfortunately. And then we have our community health workers who are employees of Meridian who are able to go out into the field.
Very good.
And actually work with members in their home. Those healthcare workers are actually living in the communities they work in, so they are subject matter experts for all of the resources you may need. And I think that's all I have that I can remember.
Well, that's plenty. That's plenty, Sarah. Thank you. That's plenty. So as I think about those resources and support, it gets a mom to delivery, but we do understand that after delivery there are some challenges. I can think back to my undergrad days and meeting one of my new friends in the dormitory, and we were going over our life stories and backgrounds, and he shared that, hey, my mom passed, and and we of course gave our condolences, and we thought it was recent that she had passed. He's like, no man, she passed like right after I was born, like the next day or so. So let's spend a little bit of time there. How can we look at some of those deaths that occur within the same week, and how's Meridian addressing postpartum care and follow up?
Yeah, this is a topic that's very important to me too.
Oh yes.
As a personal topic, but yeah, it is true that deaths occur within most often within the first 6 weeks after delivery. So Meridian does offer 12 months of benefits after birth. So that's very important to be able to get in everything that you need for yourself as a new mom. But we do have our care managers and all the other health plan staff that we're all working together to reduce their barriers to care. Postpartum visits are so much more important than one may think, and we really want to reduce those barriers to getting to those visits. And why is it that someone may not be going? Is it transportation? Like we said, we offer transportation. Now, is it childcare? Is your provider letting you bring your child to the appointment? We can help with some resources like that. And then is it just the belief that hey, this isn't important, I feel fine, I should be fine?
Right.
Because providers are doing a constant assessing and are being able to look for things that we may not know is going on outwardly.
Absolutely.
Postpartum depression is very prevalent nowadays as well. I shouldn't say nowadays because it probably always has been. However, it's more assessed for and more bringing more awareness to it, which I think is wonderful. But even at Meridian, we are assessing for postpartum depression through a couple of assessments after delivery, and based on your scores, we can offer resources and connect with your provider to let them know what is going on and any support that they may be able to help with too. I would be remiss without mentioning doulas in this space too. Doulas help out in the postpartum period and are able to be the eyes and ears in the home. Help out with any resources, and then I guess, again, with the care management team, we are assessing for signs and symptoms that may be concerning.
Absolutely.
You mentioned, unfortunately, your friend's mom, and I wonder if somebody had assessed for something that was going on. Um,
Right.
what could they have caught early? So definitely keep in touch with your care team at Meridian if you do
Yeah.
have one, and let us know what's going on.
Encouraging. I got to connect back to home health, right? And looking for advice, as president and CEO of American Advantage Home Care. We do a lot in the community to help out folks. Usually when people think home health, they think, okay, the seniors and nursing care as well as the therapies and the like. But yeah, we take on moms as well. And how important is home health to moms?
Oh gosh, it's convenient.
Yep. Mm-hmm.
All those
Yeah.
barriers I had listed,
Yep.
but I think aside from the convenience, the doulas and the maternal infant health program nurses that are able to come out to the home and visit,
Mm.
they're really the eyes and ears
Yes.
for you, and you know can see what's going on, can do those quick assessments in person.
Mhm.
Now, Meridian does make a referral to the MIHP programs, which is the Maternal Infant Health Program,
Mhm.
um, upon notification of pregnancy.
Yeah.
So the likely, if you are pregnant, this program through the state would be reaching out,
Mhm.
and now you do have the right to decline that. But
Yeah.
again, it's very helpful having a visiting nurse to come in, and so postpartum they can
Yeah.
assess for things like they can help with breastfeeding, developmental milestones for your infant, sleep safety, car seat safety, things
Yeah.
like that that are just so important.
So important. Oh
Yeah.
man, we're gonna have you all back throughout. I mean, because it is so such an enriching conversation and enlightening, and there's so many concerns that
Yeah.
that folks have about bringing a new life into the world.
Hmm.
One of which is birth weight, Shanita. So we'll spend a little time on that, right? Low birth weight and health disparities. What are you seeing, and what can Meridian and organizations like American Advantage and other partners do to assist?
Well, low birth weight, I think we should start by understanding what low birth weight is.
Yes.
So, low birth weight is any infant that is born weighing 5.5 pounds or less. And low birth weight, when you're born that tiny,
Yeah.
it's one of the strongest, earliest indicators of some short and long term health complications.
Sure.
Infants that are born at a lower birth weight, they tend to have complications with breathing,
Mhm.
asthma, they
Yeah.
have feeding challenges.
Yes.
Because of their underdeveloped immune system, they tend to have more infections. Low birth weight, not only in the short term, to physical, neurological development
Yeah.
on that small baby, but it tends to lead into having some health complications in adulthood, such as
Yes.
kidney disease, type 2 diabetes, and also hypertension.
Wow.
So
Yeah.
it's just a full spectrum of health complications that we want to reduce and eliminate.
Yeah.
So with regard to Meridian, we are targeting and we take low birth weight serious. So what
Yep.
we do is we use our data and we look at those populations where low birth weight is more prevalent. And together with Sarah's team as well as other departments, we work collaboratively to do like comprehensive analysis of those individuals that were impacted by low birth weight, getting a full understanding of what they encountered.
Uh-huh.
Also getting a full understanding and fully investigating root causes, systemic root causes, but also understanding like the footprint of those individuals.
Yes.
Did they have stress? Did they express any social determinant of health needs? Any of those things. And then we take that data and we work to develop solutions and interventions that address those things for those coming down
Yeah.
and experiencing that in an effort to reduce and eliminate low birth weight. So it's a comprehensive approach, as I said. We're working with May Health, we're working with our doulas, but we're also working with other community partners, and we're working with our clinicians, our
Yes.
OBGYN
Very good.
specialists and other perinatal providers. We're having deep dive conversations with them, understanding, asking the questions of what's contributing or attributing to the low birth weight deliveries that they're experiencing. And then we're working with them very collaboratively to address those barriers that physicians experience. So it's basically just a wraparound, you know, care of truly understanding the data and then using that to back into evidence-based, culturally relevant solutions.
There we go.
Yes.
All right, the future looks bright. It looks very bright. As we think about all of those resources, right? Of course, we could talk about what families can do and, you know, visiting my Meridian, that's my MI, Meridian.com, MI for Michigan, Meridian.com for a lot more information and resources. On a positive note, right? Children are 100% of the future. All right. Speaking of which, what's your hopes? What are your collective hopes for the future as related to maternal health?
Well, it is my hope
Yes.
that every birthing individual
Yes.
has open and equal access to care. It is my hope that there will be investigations, full investigations for those maternal mortality cases and those morbidity cases that happen, and then there is accountability to those individuals that had exhibited bad practices that led to those cases. And then lastly, it is my hope that every birthing member and family, individual and family have access to high quality standardized care so that everybody is treated fairly and equally.
Standardized care, you know, I think I would love to see for anybody to walk into a prenatal appointment and they get the same treatment, the same test, and that they know what they're going to be doing. You know, I don't think I talk a lot about advocacy and having members advocate for themselves and educating them for that, but at a certain point, I hope that they don't have to do it all themselves.
Absolutely.
Exactly.
Oh, wonderful, wonderful.
Exactly.
Well, folks, as we wrap up this Maternal Health Awareness Month, it is our hope that we have brought enlightening information, resources, and tools to individuals out there that are indeed expecting and those family members that are supporting individuals who are bringing new lives into our world. That does it for this week, folks. Next week on the Home Health Care Today show, we'll be looking at heart health and making sure that we are more aware about living a healthier life filled with guidelines and good advice for living your best life possible. That's all.
I noticed when I moved here from New York City more than 20 years ago was that we had a tremendous number, large numbers of young Black men and women presenting to the emergency department, not necessarily with heart disease, but with high blood pressure.